Hey everybody, and welcome to today's video on Rethinking the Meaning of Life. So I have a special guest today. It's actually my mom. She's here visiting me in North Carolina, and so I'm going to ask her a few questions and kind of do a little bit of an interview. A little different from the poem series. Figured I'd take a little bit of a break from that, especially while I have her down here. And I'm going to post this up, and let me know what you guys think in the comments section. And yeah, we'll go from there. Alright, so first question, Ma. How are you doing today?
I'm doing awesome.
That's great. Awesome. So, tell me a little bit about yourself and what you're currently doing.
Well, I'm a registered nurse and I work specifically with mental health and addictions, and I've been doing that my whole career, which is almost 19 years.
Now, I know we talked a lot about some of this stuff on the phone, and you said when you were coming down to visit me that you kind of had some frustrations within the mental health field. If you can kind of give me just a quick example of what some of your frustrations are, what would those be?
I guess my biggest pet peeve is the method of which we do our treatment, our psychological treatment. We consistently have people repeat their trauma over and over and over, when they get into the emergency room, when they come up onto the unit, when they meet with the psychiatrist, when they meet with the social worker. I mean, it's always about their trauma, and it's just kind of what I believe is just re-traumatizing and making their trauma real, instead of focusing on what they are doing now, what's happening in your life now. We know you've had trauma. You're here. There's something wrong. We get it. But, why are we not starting with how is it affecting you now? You've developed coping skills. You've done all this work, or you haven't done your work, but yet it's affecting you now. So I look at it more like peeling an onion, where we start with what we have in front of us versus let's dig up the past. Let's rip off all of your scars that you've, developed over the years, covering your wounds. Let's take a surgical knife and just split them open and just re-traumatize you. And I think that it's about time we got out of those little dark ages.
All right, cool. No, great answer. I know we talked at length about a lot of these subjects before, and I kind of wish we had the microphone recording at those points. I mean, we've talked about hours and hours about these type of topics. I know you said something to me, along the lines too, especially, medication is huge. Commercials for medications run rampant on television, especially local channels, not even on mainstream cable. What is your take on the use of medication, prescription drugs, for treatment for these type of patients, and what has that become?
It's become big pharma market, and one of the things that you see in research, there's a lot of research, so if anybody wants to check that out, that supports that antidepressants are really made for people who have severe depression versus those who have mild to moderate. With those who have mild to moderate depression, you certainly can be treated with alternative things such as, exercise, eating well, speaking to somebody, having support in your lives. There's so many other alternatives, but immediately we kind of jump to the idea of, I'm depressed, I need something. And that just kind of feeds into the fact that I'm sick. As far as the commercials go, I think they're absolutely adorable. I love those little bubbles jumping around. I love all those little things. But what it does, and what I've recognized for myself, is like, oh, that little animal or that little thing is so cute. I want to buy that medicine. I want to have that medicine because it's going to make me happy. And so I think that commercials are made to make people think that if I take a pill, I'm going to be okay. And that really disguises the fact that there's a lot of internal work that you need to do. Solving your problems is not about taking a pill. Your problems are working within yourself and whoever you choose to work with, whether it's a therapist or a psychiatrist, whatever you choose, to really deal with your issues and then move forward through that versus popping a pill and saying, yay, I'm cured, and then move on and you still do self-destructive things. So I think that, the commercials are just a lie about, what your life is really going to be like.
Right, and actually, I know you've watched some of my videos, and I did talk about that in one of them, the idea of, me doing these videos, putting myself out there, becoming nervous. I have nervous tendencies. I'm kind of all over the place sometimes. I mean, me being my mother, but, the answer I don't think is self-medication. I think a lot of people resort to alcohol, drugs, and self-medicating I don't think is the answer for any of these things. And actually, just like I said in one of my discussions, I can't remember what poem it is now, but, we create actually more problems than we're actually solving any by doing some of these things. So instead of looking for an actual resolution or an answer, we just kind of keep masking it and creating more problems. What do you think about that?
No, I think that that's very true. And I think that there's one commercial, I don't want to promote commercials at all, but it's to an adjunct medication, which is actually an atypical antipsychotic, which they're doing a lot to help treat depression, which is not working. And what they do is this little person has an ice cream stick and they have this little face on it. And, when they're with people, they're inside of them, the persona itself is actually very sad. And when they're talking to people, they put up this little mask. And so I think that that's really what we all do. We all run through with these little, things about hiding who we are and what we're doing. So I think that that's a really good demonstration of just the whole thing in and of itself.
Very good. I actually couldn't agree more. And I also can't believe you're my mom. But anyway, moving on. So I do talk a lot in my poem videos about being self-reliant and kind of, turning inward and being empowering and finding that, within you. Given your current position and what you're doing in your profession, what is your thoughts on, becoming, your greatest version or highest self and being empowering? How does that relate to what you're doing now?
I think in our current system, it doesn't allow for that. It doesn't allow for people to be empowered. Again, it goes back to what I first said in regard to re-traumatizing people. Instead of doing that, we should be working on focusing on the positive things that they do, little things that you can do, finding bright spots, looking at something good about yourself. Those people who've suffered really severe trauma, they're survivors, they're not victims. Our system keeps them as victims. You're a victim, you're a victim, you're a victim, you're a victim. That's all you hear. When actually you're really a strong person. You're a strong person who had stuff happen to you that you didn't deserve, you didn't ask for. But yet we keep you stuck and we look at you as a victim in our current system. So how can you empower somebody at that point? We need to make some drastic changes to start focusing on, yes, you need to work on yourself. Yes, you need to be positive about yourself. Yes, you need to recognize yourself as a whole human being, not this distorted whatever you want to call it that we've made you into.
Interesting. You talk about being a victim and playing that victim consciousness role, and actually that's something that I'm going to actually touch on in later poem videos in the series, but I'm glad you actually brought that up. I guess for the person that's seen each one of my videos, you kind of get a glimpse of that's where it's going. Like I said to you, that I can actually prove that in some cases you're actually responsible for everything that happens to you, and when you stay in that mindset, and the problem is when the system is actually keeping you in that mindset, you're not going to get better, you're just going to end up getting worse. And that's definitely, I think, is a huge problem and why we don't see people get better from a psychological standpoint. And yeah, do you want to add something? Go ahead.
I do. I think that that's one of the things with, we talk about, obviously I'm in addictions as well. And when you see people coming back in and back in and back in and back in, one of the things that we talk about is that fact that the system perpetuates that. Our system perpetuates all of our mental health issues because we just don't have either the resources or the knowledge or the skill or just the approach that we're using. So, that has a lot to do with not just the mental health piece, but the addiction, recidivism that just consistently happens.
Cool. And just while we're on that topic, I did want to get I know you worked in a rehab, was it drug rehab center? Was that it? Or
yes.
Kind of basically, yeah.
Yeah,
okay.
Substance use.
Yeah, okay. So I wanted to get your take now. The whole idea, the big push for medical marijuana, the idea that, the studies show that, angel tears, the cannabis extract can, cure cancer, tumor growth, things of this nature. Why would this be, a plant be illegal, yet we're allowed for doctors, to hand out these opiate drugs? And, what's your take on all this in that sense?
Well, as far as our standpoint, I have to say that, it is still illegal in most states, and that there's a big difference between the marijuana that people are smoking. Even if they have a medical marijuana card, they're still smoking usually other stuff that's not even, controlled or monitored. There's a lot of problems in and of itself. Using oils is a whole nother animal, so I'm going to kind of defer that piece.
That's fine. Yeah, I just wanted to... Yeah, okay, go ahead. Yep,
the opiate part, I think that it's such a twofold, threefold, 500-fold issue because of, there are people who use opiates to cover their pain, legit pain. There's people who use opioids because, somebody gave it to them right off the bat. There used to be, and maybe there still is, I just haven't seen it, a protocol for treating pain. And, now, again, I'm going to hit big pharma. OxyContin was really the drug of choice, for cancer patients. And then all of a sudden it became the drug of choice if you had your tooth pulled out or you had your appendix taken out. So there is some issues, with obviously irresponsible prescribing. But the new laws that are coming through, at least where I live, I don't know about the whole country, but where I live, some of the laws that they're making now as far as treating people who really seriously do have, honest to God, chronic pain, they're not allowed to get any kind of long-acting opioids through responsible prescribers. And, what they're doing is they don't recognize, I think, as a government, they're going in and saying, hey, we did something about this opioid crisis. When in reality, and making people have to spend more money as far as trying to buy pills off the street, which is a huge issue, they don't have that. So people transition to using heroin. So in my state, I think they're just creating and perpetuating a whole new clientele for heroin. So I think that
Awesome.
it's really, I think it's challenging, but I think that in most cases, people don't know what to do with it. They don't know how to work with it. They don't understand it. And for so long, addiction in and of itself it's a moral issue. Oh, wow, that person's bad. And it's not a moral issue. There's so much research out there that supports that it is a chemical thing in the brain. It is real. People have shied away from it so long, and being in both the mental health and substance abuse field, there are people who are psychiatric patients who'd rather be identified as a drug addict than a psychiatric patient. So, there's a lot of stigma related to the whole thing. And I think that, the opioid crisis is what it is. And now it's really sad. I think that, again, Big Pharma made their money, and now it's time to kind of like, hey, we got a crisis, let's fix it. So,
making money, just double dipping here.
It's double dipping in a lot of ways, and it's just really frustrating. It's really sad because we are losing so many precious lives because of it.
I mean, I'm pretty sure from your response, I know we talked about this earlier. I mean, we've talked about this stuff in depth that, I think a lot of the problems, whether it be addiction or even some of the mental state of people in this country or in the world, even for that matter, especially you deal with these people on a daily basis, I mean, is kind of our own doing, whether you want to say it's, big pharma, the government. We did talk about the whole concept and idea of a psyop, and it's actually kind of funny because in the truth community you hear that a lot, and it's kind of funny to hear it coming from your mom, but also that you do deal with medical health, and when the psychiatric, we're psychiatric RN, it's kind of funny to hear you say that because most people would say, I just talked in my last video actually, the idea of conspiracy, or when you hear that, a psyop, oh, it's just some CIA thing that doesn't exist, that's just. Do you think some of these things, are self-inflicted? I mean, a lot of this, whether it's addiction, psychiatric issues, like I said, re-traumatization is actually ingrained in us throughout society. I know that's a loaded question, if you just want to touch on it just a little bit or kind of just start talking and, see where it goes, that's cool too.
Well, you said earlier that sometimes people look at you like you're a little crazy.
All the time, yeah.
Within my field, I'm kind of out of the box, and so that kind of means that I look at different things when I talk about the psyop aspect of it. I look at commercials, I see it like we talked earlier. I look at things that are happening, how we do things, and I have to say that I don't never discount that. I believe that there are a lot of things happening. I believe, again, I'm sorry to say, but I believe that there's a campaign to keep people sick, whether it's mental health, it's medical, whatever. I'll just use a medical example. Back in the day, there used to be this thing called, oh, if I get cancer. And now in the day, it's like, when you get cancer. There's a big statement there. And, when you talk about the institutions, not the individual people who have the illness, when you talk about, that aspect from the institutional side of it, and, there's all these little places popping up that are saying, hey, we're going to treat you. Yes, they are. They're going to treat you. But it's the words that people use. And that's one of the things that I'm going to totally steer off and say, what we tell ourselves is extremely important. And, when we focus on those negative pieces, when you're going to get, you did this, or anytime that you accept any kind of blame or bring something into what you would call your reality, you're setting yourself up. And, so that's why when, Chris was talking about the PSYOP aspect of it, I noticed that, and that's like the best example that I have.
Well, they're basically creating the victim there.
They are, and then they're saying that you are going to get this, and I firmly believe I'm more of a holistic-minded person, which is a very big struggle in a very, very, very structured organization, meaning within the psychiatric dome. It's really kind of hard to really think out of the box and push for that when you know that more holistic treatment is really when we stop ignoring that the spirit is a part of the human being. Holistic is defined as everything connected together, but yet in the medical field, we still treat psychiatric stuff as, oh, you're over there, and then medical, oh, you're over there, and we forget all about the other piece of a person, which is their spirit. And so that is where I think that, we could do a lot better in altogether.
And you think that whole connection with the spirit stems more from the Eastern philosophy and medicine as opposed to the Western view?
Oh, I mean, there's a big difference. There's a great difference between the East and the West. And what really frustrates me is, we're promoting, saying we're doing holistic. Everybody, that's like the new buzzword. We're holistic, we're holistic, we're holistic. But yet we're using the same treatments. Or we throw in a little bit of this or that. I know in some of our substance use programs, we throw in a little bit of acupuncture, just a little bit. We don't treat the whole piece. We're like, okay, we'll make you relax. We don't talk about the benefits outside of relaxation that, acupuncture can do. We don't talk about body psychotherapy, which is a lot of somatic things because our bodies hold a lot of that trauma inside of us, we have muscle memory, we have tissue memory. Like those things are real. We're not just an individual. We're not just this walking skin with some organs. Our body has so much more awareness. And, again, all these things contribute to chronic pain. All these things contribute to addiction. It's just really a struggle and a frustration when you see that modern medicine uses buzzwords and catchphrases to say we're treating the whole person, but yet we forget to see who the person really is and what they need. We forget to look at what does the person need. As a nurse, we're very task-oriented. And we're there to say, we got to fix you, we got to heal you. That's kind of why I love addictions and psych, because bottom line is, if you think you're going in there to fix somebody, you might as well get out now, because you don't. The best thing you can do is help people heal. And, that's what motivates me for it. And that's why, I'm kind of more out of the box. I'm not like the nurse who's going to say, I'm coming in to fix you. Because
people want to fix themselves.
People have to fix themselves. You can't fix anybody, no matter how hard you try. Yes, you can bandage their wound, but you can't, and you can cast their leg, and you can do this, but you cannot fix them from the emotional and spiritual side. They have to do that work.
Right. And like I said, it requires effort in one of my other videos, and that's the thing. Actually, it was in Come All You Sheeple. And that's the whole thing, that the idea of, why we don't do things, we're lazy and it requires effort. So we just say, screw it, and just kind of give up.
We are lazy, but in not the same sense. I wouldn't transition it into the same sense. The work that we're asking them to do, especially those, with trauma and, those kind of things, the work that we're asking them to do is hard. When you think about actually looking at yourself, and you look in the mirror, but you're not looking at a regular mirror, you're looking at your inner sides. And to try to come to grips with that, when you have guilt, you have fear, you have all of these things, why would you want to look at that? I actually can understand why people use drugs. I get it. You know what? I mean, when you've been so abused in your whole life, why would you want to look at your life? But the journey is to walk through, and that's what the patients don't necessarily understand. Walking through with support is going to get you to the other side and the healing. So really looking at yourself and knowing that you're not responsible for what's happened to you. So that's a big difference in the treatment aspect of it. So you can understand it is hard work. Nobody wants to do hard work, except for maybe some people who really do hard labor, and stuff like that, but, I honor them because I'm not that person. But, I think that, yes, it's hard. And it's not always lazy in that, like I said, in the traditional aspect. It's lazy because, damn it, I don't want to do it.
Right.
I just want to, clarify some things too. I know some of the things I'm saying is pretty harsh toward the mental health field, the addiction field, but there is a lot of treaters out there just like myself who really feel this, and I know that they're every bit as frustrated as I am. From the lower sides, we know we're down in the trenches. We know what patients need. we see it, and there's like a super amount of people out there, that are doing, some great work. It's just the structure that we're put in. So I'm really kind of bashing the structure more than the people who are doing the job.
Right. I think that's actually kind of a correct assumption to make. I mean, not even an assumption or just an observation, more or less, that, even when I do some of my videos here, it's not individual people. Usually it's the system that's broken and has created these certain problems to begin with. It's not the actual people. Because most people, if you think about it, usually are kind-hearted or want the best for other people. And then they hate seeing people suffer, especially if they've had similar experiences. They want the best for humanity. It just seems the people in suits, or like I said in my last video, this nameless fear, whoever we want to pin it on, can seem to care less. But I think the everyday average person really does want to see people succeed and wants the best for them. So one more question, we'll kind of wrap this up here. If you had to, say, make any one change, or where would you like to see your particular field, what direction would you like to see it go in?
Well, I guess I would just share my imaginary life, and what I vision, and what I think is more on the ideal aspect of it. I see treaters, between medical and, psychiatric and all the other, substance use kind of come together, and stop going away from the things that, we're currently doing, and kind of bring in, specialties as, maybe, Bach flower remedies, or full acupuncture, therapeutic massage, yoga. A lot of the Eastern philosophies, kind of, coming in to show how much they can help in conjunction with those great evidence-based stuff that we're already using. There's really some good, treatments out there that, are evidence-based and they're supported. So I think that, just everybody dropping their egos. I think I'm really frustrated with ego. I think that we really need to kind of let go of that. Ego is just pride, and pride is just, never a good thing. In my ideal world, I'd like to see people collaborate more and really look at the patient. Everybody's an individual, and not everybody's a cookie cutter. We don't fit into that, insurance world of, you have to hit this diagnosis or that diagnosis or this, just to generate revenue. The poor providers, they want to provide treatment, but they can't because they have to meet these requirements. So I would like to see a lot of that just all absolved. And, as unrealistic as I am, that's still my dream.
But I don't think it's unrealistic, and that's kind of the reason why I created this channel, is to get people to think differently about a lot of different things. The reason why I even brought my mom here today to talk about this stuff, the psychology, a little bit of things, I understand how important that is. I just kind of wanted to have someone that's been doing this for, how long you've been doing this, last 20 years or so?
Just about
20 years. So she has a lot more experience and is doing this at the ground level, is not a paid shill like I know a lot of people like to, get on YouTube and all these other social media networks and just start typing hate messages and things. This is stuff that she deals with on a daily basis. And, stuff that's important to me because I think, at the end of the day, psychology, the mindset of people, this has a lot to do with, the current state of our society. And like I said before, I think it's important to get as many people's perspectives as possible. Majority of people are kind-hearted and want the best for other people. It's a select few that maybe are unhappy with their own lives and so on and so forth, that are trying to make every life miserable for everyone else. But just kind of get together for some kind of common cause. No matter what religion you are, what you believe in, or what kind of car you drive, where you live, we're all humans on this earth. Let's just kind of get along. I mean, I know it sounds cheesy, but at the same time, what's all the hate for? And I think it stems from this psychology aspect, because for some reason we've just been conditioned, whether it's through music, television, commercials, the drugs, the food, all these different things. We've basically been programmed to condition to think this way, and it's just not natural. What we've talked about today, there's obviously some problems. Like I said, and that's the reason why I created this channel, to get people to think differently about these things. So I hope you guys enjoyed the video. It's definitely a little bit different. Some of the videos I think coming up after the poem series are going to be like this, kind of a talk with different people, maybe friends of mine. In this case, my mom happened to be down in North Carolina, so she kind of wanted to do this, and I thought it would be great to have her on, because it kind of goes along with, what I'm all about on this channel and kind of what it's about. So, Mom, did you want to add anything before we sign off here?
No, I can't reinforce what you said more. Let's put some positive out there in the world. Let's really, it is cheesy, but it's real. Love each other, be kind, and, just respect who people are, regardless of what you may want to think. We were born judgmental, but we need to not be.
So guys, I hope you enjoyed the video. If you have any comments, questions, or concerns, please feel free to leave them in the comment section below. Tell me what you think, and thank you for tuning in. Thanks for sticking with this video. Definitely one of the longest ones I've done to date, and even though I could have gone longer, I appreciate you sticking with me. Thanks for tuning in, and I will see you in the next video. Take care.
Never seen the sunshine brighter, and it feels like me on a good day.